Alright, so in this video we're going to jump into the question of how do I handle capitated or other at-risk contracts. So typically these contracts tend to have a negative connotation associated with them. They aren't necessarily bad though. The reality is they're just different and you have to learn how to deal with them. And if you do learn how to do that, they could be an advantage for your group. So in the short term, what are the things you need to focus on? First off, you want to price that contract appropriately. So what you want to do there is look at a patient population that's similar to the one that's coming in capitated or at risk and formulate a price that is not going to give you a lot of downside exposure on that contract. So that's step one, and we can help with that if you need help with it. Step two, this is really the biggest shift with capitated contracts, is you need to become cost focused. Typically speaking, traditional fee-for-service contracts, that's a revenue-focused kind of endeavor for providers, but now you become cost focused. So it's a total switch in terms of how you need to think about the business, and realistically, you're going to have to, within your administration, find a few people to kind of take this on because it really requires a big shift in terms of how you operate. And then step three is to update your contracted price as needed. Typically speaking, fee-for-service, you have your payments at the CPT level, so you get paid for what you do. Capitated, you just get a check. So you need to develop the internal reporting systems to be able to handle the performance of these contracts so that you're aware of when you're losing and or making money on them. You need to know that. If not, you can't negotiate the rates appropriately. So long term, so that's short term. Take care of those things in the short term as you bring on capitated contracts. In the long term, you have two goals really. First, you want to manage to provide care at the lowest cost possible. That does not mean sacrificing quality by any means. It just means being creative and figuring out ways to build teams around your physicians where those physicians can do more work and the quality of care is not sacrificed. And then the second thing is not just inside of your clinics, but outside of your clinics, you become somewhat responsible for what patients do. So you need to start thinking much more like an insurance company here and thinking through how can we manage population health overall, specifically for your specialty or for what you work on, because you're at risk for really all their conditions, not just the clinical work. So those are the long-term focuses. If you manage to achieve those two things, you have a long-term opportunity. And essentially, if there's an insurance company within your market looking to pass on their risk, you're going to profit the most from that contract compared to your peers. So that's one advantage, and that's learning to become the lowest cost provider. And then the second advantage, and that's more around managing population health, is that payers in your market may benefit from shifting risk over to you. And then again, you're better than your payers at managing that risk. So you're again at that moment looking to profit more from it. And the payers want to shift the risk over to you, so it gives you a high growth opportunity that no one else will really have. So here we covered some high level strategy for at-risk contracts. There is data related analyses that can go on with at-risk contracts. So if you need help with really anything on this topic, feel free to reach out.